My name is Dr. Bruce Freund. I am a family dentist in Bergen County, Englewood Cliffs, New Jersey. My practice is geared basically towards cosmetic dentistry. Well, I've always been interested in art, and I have taken many courses throughout school and privately in the field of art. I sculpt, I paint, and therefore it leads me to the cosmetic end of dentistry. I found that working in the cosmetic part of dentistry was like creating and painting a picture. You're starting with a certain level of cosmetic tooth, so to speak, and your end result is something completely different. So when I do a set of laminates or when I do a set of crowns, it's the same thing as painting a picture. And you get the same gratifying feeling at the end. I believe that when patients are looking to lighten their teeth in this day and age, and they come in and they talk about bleaching, I believe their expectations are for the most part unrealistic. And I have to be very realistic with the patient. I have to explain to the patient that if you're looking to go from where you are to these beautiful white chiclets that you want, it's not going to happen. So I do believe that their expectations are unreasonable. On the other hand, if a patient comes in and they're looking for veneers or laminates, basically the same thing, or crowns, their expectations usually are not limited. I can give them basically exactly what they want. A veneer and a laminate is exactly the same thing. There's no difference. You may hear the word lumineer today. Same thing. No difference. It's just a specific company is making a laminate and they're calling it a lumineer. The process of a set of veneers is very, very simple. It can be done in 2 visits at the least. It could be done in 3 visits at the most. On the first visit, what we would do is we would take study model impressions and we would prepare the teeth and we would take our regular impressions. On the second visit, you could come in and have all the laminates placed and you'd actually be finished. If we were doing the upper jaw and the lower jaw and maybe 10, 12 laminates in each jaw, you might want to split up that second visit into 2 visits, 1 jaw at a time. But it's not necessary. I've done many, many cases where the patient comes in on the second visit, all the laminates are placed, and it's completed. I myself have been doing laminates now for over 25 years. I was probably one of the first dentists to do laminates. I actually worked for Denmat Corporation, which is the company that really created the whole laminate frenzy in the United States. And I actually worked for this company in the mid-90s teaching preparation and insertion of laminates to other dentists. And I did this for quite a number of years. The preparation of laminates is very important. There are basically two types of dentists. There are preppers and non-preppers. Preppers mean that a dentist will cut the tooth back pretty much. Non-preppers mean that they will really take minimal tooth structure away, unless a tooth must have the tooth structure taken away to get it in proper position. I am a non-prepper. I believe that you can almost make a set of laminates without touching the patient's teeth, putting them over their natural teeth without prepping. So I am from the school of the non-preppers. And like I said, I've been doing this for over 25 years, and it does work. Of course, there are certain cases where the teeth are too far out facially, for example, to begin with. So you need to bring the tooth back to put them into a proper position, so now when you put your laminate on top, it's not out further than the tooth was before. My actual goal is to not prepare the tooth at all. I mean, your average timeline would be between preparation on the first visit and the second visit, without rushing things, okay, 10 days. A week to 10 days. Now, we could rush. We do certain things with the lab to really push the case. Most of the time there's no need to, because if there was preparation and a decent amount, the patient will leave with a temporary. So the temporary will look exactly like what the patient came in with. So basically there's really no need to rush. Somebody might have a wedding coming up or going on a vacation, and we can rush, and we can do this in 3-4 days.